Hello teacher, this is Pablo Hipolito Guzman, and now I will continue with the exercise that I have all of here. Let me show you. Okay, I do it in my notebook. Look, all of this in that page. Okay, let's start it. Let me put it in there. Okay. First is English verb tense, medical context. Part 1, multiple choice. Choice the correct answer. One is the nurse usually monitors vital signs every 4 hours. The patient has experienced chest pain since early this morning. The doctors has confirmed the diagnosis before the patient arrived. 4. The patient was taking medication when the allergy reaction started. The surgeon will perform the operation tomorrow morning. 6. The patient any improvement so far? Hasn't shown. 7. The lab result will have been released by the end of the day. The patient was staying in intensive care when complication occurred. The doctor will change the treatment plan if symptoms worsen. The patient had been taking medication regularly before hospitalization. 11. The nurse hasn't given the injection yet. The patient was taking painkiller while waiting for surgery. 13. The hospital will implement new safety protocol next month. 14. The patient had been reporting symptoms for several weeks before diagnosis. The doctor is reviewing their test result at this moment. 16. The patient will be discharged unstable. 17. The nurse has checked the dosage before administering the drug. 18. The patient will have had surgery by the end of the week. The doctor doesn't prescribe antibiotics for viral infections. 20. The patient have taken blood tests when the doctor arrived. 21. The surgeon had been performing the procedure for 3 hours. 22. The patient has experienced allergy reaction in the past. 23. The nurse cleaned the wound when an infection was detected. 24. The patient will have been fully recovered by the next appointment. And 25. The doctor monitors the patient condition carefully every day. And that's it of that part. Let's continue with the part 2, fill in the blank. Complete each sentence with the correct verb tense. Number 1, the nurse checks the patient blood pressure every shift. Number 2, the patient has experienced nausea since this morning. Number 3, the doctors have reviewed the test result before surgery. 4, the patient is receiving treatment at the moment. 5, the surgeon performed the operation yesterday. 6, the patient does not take the medication regularly. 7, the hospital will implement new regulation next year. 8, the patient was waiting in the emergency room when symptoms worsened. 9, the nurse had administered the injection already. 10, the doctor will adjust the dosage if necessary. 11, the patient will be discharged tomorrow. 12, the lab has been analyzing the samples all morning. 13, the patient had been suffering from headache for weeks. 14. The nurse was monitoring the patient during surgery. 15. The doctors have not finished the report yet. 16. The patient will have recovered by the next follow-up visit. 17. The surgeon have completed the procedure before complication arose. 18. The patients did not feel pain during the procedure. 19. The nurse was preparing the equipment when the doctor arrived. 20. The patient have taken insulin for several years. 21. The doctor is explaining the risks at this moment. 22. The patients have had blood tests early today. 23. The hospital have upgraded its facilities recently. 24. The patient was monitored overnight. And 25. The doctor prescribed antibiotics only when necessary. Thank you so much for seeing my video, teacher. Have a wonderful, beautiful day.